Good morning, everyone. Before I came in today, my son's advice to me was very singular. He basically said, "Dad, please don't make it boring." Right? That was the only thing that he said. Fair enough. But my request to you is, you have to make sure that you don't make it boring for me as well. So it's going to be an interaction. I'm going to be presenting, but I'm also going to be discussing. I'm going to ask lots of questions. Okay, so it's going to be both ways. So you're not just going to sit there and I'm going to go through many of these slides. Practically with each slide I'm going to ask you to think, I'm going to ask for responses as well. Okay? That's the first thing. Second, in terms of, let me introduce myself, and then if you can introduce yourselves, your name and the topic that you've chosen. You've all chosen a topic for Pop already? Yeah? Okay. So, I'm Paul Lalvani, Mayor's dad. And the work that I've done basically for the last 20 years has been in public health and private health. I've worked with, have you heard of the World Bank or World Health Organization, UNICEF? So I've worked with all these organizations. Right now we're running a public health institute here in India, so we teach students, normally graduates who are about 20 plus years old, in various areas of public health. How to run hospitals, how to take care of public health programs. And we work in about 24 different countries. Okay, we've just come back from a trip in Asia Pacific where we had to do some work. And we work in Africa, we work in Latin America. So good perspective of rich countries, poor countries in terms of what's happening. So the experience I'm going to share with you will bring all that into account, and hopefully I can address all your interests as well. So I'll start from this table, ladies first as I say. So your name and the topic that you've chosen.
My name is Sunhong Park, and my topic is tuberculosis among the poor.
Okay, can everybody hear? Yeah.
My name is Erin, and my topic is short life expectancy
Short life expectancy in India. So life expectancy. Do they have, I can't write with these, right? Are these are just for these markers here? Will that work here as well? So are there other markers? These guys here? Yeah. Alright, so go ahead. TB, life expectancy. Go ahead next.
My name is Trisha, and my topic is malnutrition is malaria.
So we have TB1, life expectancy 1, malnutrition. Next.
My name is Kabir, and I'm doing malaria.
Malaria. Alright, next. Malaria and something or just malaria? Okay.
I'm Ankit, and my topic is malnutrition and its effects on children.
Okay, wonderful.
My name is Zekron, and I'm doing TB and multi-drug resistant TB.
Oh, fantastic, okay. That's complex, we'll discuss more.
And I'm doing TB among the poor.
TB among the poor, very good.
My name is Kyle, and I'm doing COPD.
COPD, alright. Can you tell everybody else what it stands for?
Chronic obstructive pulmonary disease.
And in simple English, that would be?
Lung disease.
Okay. And an example of the lung disease is? Can you think of something? A lot of people have it in India, experience it. What's a simple term for it? Asthma?
Yeah.
Yeah, for example. Yeah. Okay.
My name's Lachlan, and I'm doing TB.
TB?
My name is Jared, and I'm doing spread of malaria.
Spread of malaria. Okay.
I'm Christopher, I'm doing the spread of malaria.
I'm sorry?
Christopher, and I'm doing spread of malaria.
As well, okay.
I'm Tyler, and I'm doing food storage systems in India.
I didn't hear you. One more time.
I'm Tyler, and I'm doing food storage systems.
Food storage systems. That's interesting. Can you tell me a little bit more about that? That sounds different.
Like the food grains rotting in India and how there's too much grain.
Very interesting. Okay, okay.
My name is Sintalo, and I'm doing malnutrition.
Malnutrition?
My name's Karan, and I'm doing how poverty affects malnutrition.
Poverty and malnutrition.
My name's Tyler, and I'm doing poverty and malnutrition.
Poverty and malnutrition and managing malaria. Okay, how did I know that? Alright. Okay, at least that means he speaks to me at home, so I know what he's doing. Alright, that's good. Alright, So I have a lot to cover. I was asked to talk about HIV, TB, malaria, and malnutrition. So I'm covering this. I do talk about this a little bit in various areas. So this is covered, this is covered. These two aren't. But there are discussions on this as well over here when we talk about non-communicable diseases this country. So we'll talk a little bit more about this. Food storage. I've worked on this. It's basically about supply chain and everything else. It's a very interesting topic. It's something unusual. It's not part of today's talk, but if you need some discussions after class, I can do that as well. Okay, but you'll find the rest of the talk interesting today. In terms of understanding POP, in your opinion, which subject is most closely aligned to? You've got all the different subjects. Which subject is it, as far as you? Humanities?
Yeah.
Science? So some people think it's closely related to humanities. Okay. Did I hear science as well? Really? It's your mom.
Oh,
I mean, hang up on it. We'll come back. All right, anybody else? What other subject is aligned to? Health? Yeah? Okay. That's it? What if I said math? Absolutely. Absolutely. Come on, she's sitting here. Of course, a lot of math. I mean, I just saw one of the things that you guys are going through. You're doing this, right?
Yeah.
Right? But what if I also said it has to do with English? Okay, it also has to do with, I mean, it's actually everything that you're, what are the other subjects that you're working on? Hindi. Well, there'll be some Hindi as well in some of these things as well. PE, yeah, well, French and PE, no, but everything else is there. It's really, I mean, the POP project really brings everything that you're doing together, okay? It's even what you're not being taught, economics, okay? Maybe you were taught some of this already. Business studies, etc. Okay, it's all part of this. It's also social sciences, which comes in here, all right? So let me go through one by one, these slides. Is there a remote to go through, or do I just...
so if you touch the screen,
Ah.
it should, no.
No, this one? Okay. All right. Before I start, this is something that I read recently, and it's really powerful, and it's something that the American school tries to bring to bear. Does this make sense to everyone? The original idea is, let me just read it out. Education is not about filling the bucket, it's about lighting a fire. So I'm not pouring information into your head. What I'm trying to do, or what the objective of education is, to get you excited about life, to get you excited about what this is supposed to be. Right? These are great years for growth. So don't think about this as information. This is about getting you excited about stuff. So the whole presentation is about, I'm going to go through some definitions. I'll go through it quickly so you understand what I mean when I say communicable, non-communicable diseases, mortality, morbidity, when I say incidence and prevalence. And I'll ask you first to see if you understand what those means. Okay? Then we go through why public health is important, the different diseases, and some of the solutions. Has anybody heard of the Millennium Development Goals? Yes?
I've heard of them, but I haven't been
Yeah. Does anybody know a little bit about the MDGs, as they're called? Really important. The UN and all the smart people are working in what's called development. Development basically means in areas that help people come out of poverty or help educate them, have a better life, better living. They came up with these 8 goals, and they felt that if the world focused on these 8 things, they can basically alleviate poverty and improve the health and education of the world. These 8 categories, really important. Everything is referenced, and I'll leave the PowerPoint behind. And look at the different topics, okay? Eradicate extreme poverty and hunger. What does that link to? Malnutrition. Achieve universal primary education. We're not talking about that here, but that's another critical area. If you educate people, they'll make better choices. promote gender equality and empower women. It's known that if in any family, especially when you go into the poor areas or rural areas, you empower the women, you educate the women, the family lives a better life. And in most cultures, the women are less privileged, less educated. Okay? So they need to change that. Reduce child mortality. Is this related to anything here? Somebody chose one topic. Yeah, absolutely. Okay, I can link with many of the others as well, but especially there. Improve maternal health. Why is that important? What does that link to? Life expectancy as well. Okay? You improve the mother's health. The mother survives, the child survives, and have you heard of IMR and MMR? Infant mortality rate, maternal mortality rate? Yeah, it's all an index of how well a country's health is. Combat HIV/AIDS, malaria, and other diseases. They realized that what they did when they did this, so these are communicable diseases, right? And I'll explain what communicable is. So we'll discuss a lot more of this. Ensure environmental sustainability. While we're growing economically, a lot of companies are basically polluting the environment. We're using strip mining type things, destroying the environment. A lot of lead-related, waste-related things being thrown out. So you have to take care of the environment. If you do everything else and you forget the environment, you'll end up destroying the country. And develop a global partnership for development. That's a bit more nebulous. All right, so MDGs, really important to sort of put things in context. Human Development Index. This is just to give you a sense. You know, when people say how good a country is, how well it's developed, you look at multiple different areas. And I think it's mentioned, it's a comparative measure of life. Look at the different things it looks at. Life expectancy, literacy. What's literacy?
If you can read and write.
Reading, writing, education, right? And standards of living in countries. So they combined all of these things, put it in a matrix. I'll do this and I'll come back again. So Human Development Index, health, education, income, how rich, inequality. We just talked inequality between whom and who? And women, what I just did. Poverty, gender, sustainability, and population as well. They put all of that in a box and then mapped out the world to see how different countries basically scale. And if you look, highly developed, okay, you can see some of the dark boxes. Not surprising, these are the richer countries. That's very high, then medium. And you can see the white patches. These are countries of concern, right? So, can you give me some examples of countries that are on white patches? Most countries in Africa, and what we call this is sub-Saharan Africa, right? It's below the Sahara. Okay, absolutely. Afghanistan, Pakistan. A couple more countries. Madagascar, yes. Bangladesh, yes. Malaysia is probably not low. Yeah, but it's a little confusing there. But you get the idea, okay? What about India? Where are we?
Medium.
Medium. And guess what? How many countries are there, by the way, in the world?
244.
244? Is it that many now?
It's like 200 something. Told you.
It's over 200. Is it really? It's over 200. It's about 200 plus minus. Okay. I mean, which is the latest country that came out? The newest country on the planet.
South Sudan.
South Sudan.
South Sudan. Okay. All right. Is there a North Sudan?
Yes.
It's just Sudan itself. That's right. Okay. And I think there are about 200 countries. Can somebody look up after we're done and shoot me an email how many countries there are today as we speak? Okay. Now, guess what? India's ranked 134. Not very good. Okay. Not very good at all. Look at this. This gives you a sense of how big India really is. These are the different states of India. And you compare them to the different countries on the other side. All right? So, which is the biggest state in India? Uttar Pradesh. It's as big as? Yeah? Now it's even bigger, by the way. This is, I think, this is 2004 census of India. It's much bigger now. I think we're almost at 190 over there, so we're already bigger than Brazil. But it just gives you a sense. Look at that. Brazil, Mexico, Germany, Vietnam, we encompass all those countries. And these aren't even all the states. How many states in India?
30 some.
Yeah, about 30. Okay? These aren't even all the states. 1.2 billion people. Okay? Again, you know, the pop project, this stuff that you're doing, really interesting stuff that you can do with. Alright, now check this out. Can somebody walk me through that? Who's doing life expectancy? Can you tell me a little bit about what does this image tell you? This graph tell you? Yeah, that's very good. That's interesting you picked that one up first. Now why is she saying that? Why are there more? Go on, speak up.
Families prefer boys because,
No, sorry, how does that graph tell me there's more boys than girls?
oh, because the scale on the left of the graph where male is much wider, while the scale on the right is much.
Yeah, okay, fair enough. See, there's more blue, right? It's heavier, it's leaning to the left. That pyramid is leaning to the left. Okay, what else? Can you tell me a bit more about, what else? I'll leave it open now. All right, tell me all the different things that this chart tells you. One from each table, all right? You've already spoken from here. What else does this chart tell you?
Population for males is much a little more bigger because it's more lighter than the female.
Right. Let me see if you know how to read this. Which age group is the most widely represented in India?
Infants.
Infants, right?
Yeah.
Isn't that interesting? So the largest population is from 0 to 5 in India, both for boys and girls. And as you get older, there's fewer and fewer. Why is that happening? Life expectancy is low, people are dying, malnutrition, all sorts of problems. Okay? Could you just switch to the next slide? And look at this, look at Switzerland. Look at the shape here. This is a typical shape of a developed country pyramid. Look at the boys in the blues and the pinks. Is that about the same? Which is the largest population, age group represented here? Yeah, 45, 50. Okay, 40, 45. So it's not the 0 because most kids born end up surviving. Most kids don't die, right? So they produce less, they end up living. So you're all familiar with the mean, mode, and all that other stuff, right? So here, but there are others, while this is good from a developed point of view, what % of the population do you think is between the ages of 50 and 20, the working population, approximately, if you just look at that? Between the ages of 20 to 50. Yeah, maybe a third or a fourth, right? So people work till about 50, 60, all right? So these are the people that are currently working. If we go back, could you go back one slide, please? What about here? Between the ages of 20 and 50.
Like
Okay.
Even more.
And over a period of time, more people, assuming that they all live, will end up in the 20 to 50 group, right? The pyramid is going to take you upwards, right? That's what's happening. And look at Switzerland again. Next slide. What ends up happening here is the 40, 50-year-olds end up becoming 60, 70, and they stop working. So all of a sudden, the ability for a country to produce, to work, to earn money declines. So the developed countries are facing a big challenge right now. So what's this whole demographic dividend that they talk about? The number of new kids being produced are less than the number of people dying. So in Europe and many other countries, Japan for example, the population above 50 is massive. All right, so while it's both a positive and a negative, there's another challenge for the developed countries. definitions. Health. I'm talking about health. What is health? Health is a state of complete physical, mental, and social well-being. Okay, not just people think about what is health is I'm not sick. That was the old definition. Okay? But then they expanded that. It's not just about the absence of disease, but I should be physically healthy, mentally healthy, socially healthy. What does social health mean? Please don't say Facebook. Okay? But that's, in a way, a lot of that in terms of from a social point of view. Are you able to communicate with your friends, with the community in a healthy way? Okay? You're not isolated. I could be in perfect physical and mental health, but if I'm not able to interact with people properly. So can you give me an example of a disease or a problem that physically and mentally you're fine, but socially you're not? I'm sorry?
One that starts with an A, but I'm not really sure what it's called.
Yeah.
From A1, yes.
I didn't hear you.
Asperger's.
Yeah, Asperger's syndrome. Yeah.
Depression?
Autism, Asperger's syndrome, right? So they're perfectly normal physically and even mentally in many cases, but they have difficulty socially fitting in, okay? Although now some are saying mentally there are some gaps in terms of them being able to think and then in terms of how they interact. Communicable diseases. Again, it's being able to communicate, can the disease be passed on, very simply, okay? It's either passed on human to human, animal through human. Some examples, okay? Chickenpox, you know, you've heard about, oh, if you've got chickenpox, stay at home, so you don't pass it on. It's communicable, okay? Common cold, don't sneeze in my face, sort of thing. And non-communicable. Chronic, we talked about COPD, okay? Chronic respiratory diseases, cancers, diabetes, etc. These don't get passed on, okay? These normally end up developing one way or the other. All right, infant mortality, I'm just quickly going to go through the definitions. It's a bit boring, but then it will link in with what I'm going to talk about. But it's important that you understand these. Maternal mortality rate, infant mortality rate. Just the way, for example, if I were to ask, what's an easiest way for me to measure a person's wealth? What should I ask for? A person's wealth. A person's wealth. That's a country's wealth. Yeah? A person's wealth. One person's wealth. How much money they have, right? Okay? Simple. If I want to check how healthy they are, what two questions could I possibly ask? I'm sorry? How healthy, very simple, as it for a person. For a person.
BMI.
How fit they are, but yeah.
Body mass index.
BMI doesn't say anything. I
Yeah.
don't like BMI. Like,
Yeah, body mass index. Yeah, it's a mix of basically, let's say, height and weight, for example. So they're very simple measures, right? But how do I measure if a country is healthy in different ways? Okay? So life expectancy, and the other two things that they always check are maternal mortality rate and infant mortality rate. MMR, IMR. Okay? This is basically if a mother gives birth, how often does she die during birth? Maternal mortality rate. Okay? Infant mortality rate, if I'm born, and within the first year of my life, will I survive? You saw the India pyramid? Do you think most survive or most die? A lot. Will most of the newborns die or survive? Die. That's why they have that, right? That's why parents produce lots of children, especially in rural areas. The average used to be my grandparents were one of 9 and one of 10 kids. Okay, if you go back to Europe, you go back to the US and other countries, normally grandparents were one of 8, one of 9, one of 13. How many brothers and sisters do you have here? 2.
well,
One.
Oh, sorry, I mean, so in addition to you, how many more? 2 more, plus 2, plus 1.
8.
You're one of 8? Cool. Plus 1,
Plus 2. 2. Oh, 1.
plus 1.
1.
1.
You guys are 1.
2. All right, so the average is basically a family size of 2 to 3. Okay? It used to be my parents, one of 9 on both sides. Okay? I'm one of 4, and my kids are I only have 2 kids. Okay? So, because now if I know that my kids aren't going to survive, then I'll have about 10, hoping that 2 or 3 make it. Right? That's what used to happen. Incidence and prevalence. Do you know what that is? Have you heard those terms? Really important. Incidence is how many new people end up with a particular problem.